Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. All right, so good morning, gentlemen. How are we today?
Great. Hey, how's it going, Samuel?
It's going good. It's going good. So thank you guys for being able to get on the call. This is the Medical Sales Podcast, and we always try to bring value and get into the behind the scenes of what goes on in sales professionals' lives and our customers, which are you guys. So let's talk. I'm just going to go ahead and give the floor right away to you guys. We have three doctors with us, all based in the U.S., in the East and West Coast, and I'll let each person introduce themselves. So, Dr. Baber, why don't you start? Go ahead.
Hi, everybody. My name is Zafeer Baber. I am an anesthesiologist by training, and I also practice pain medicine in the Boston area. I work in a hospital setting at a hospital north in the Boston suburbs.
I'm Dr. Cohen. I'm an anesthesiologist and pain physician as well. I'm in San Diego, California. I have 4 different clinics out here and operate out of a combination of surgery centers, hospitals, and do procedures in my office.
Hi, everyone. Dr. Krishnan Chakravarthy, also anesthesia and pain trained. I'm really excited to be on with both Zach and Zafeer. I've known them for quite some time. I'm currently an assistant professor at UCSD Health. I actually see patients both at the UCSD, a lot of civilians as well as the VA. So, and have been interfacing with the industry for quite some time now. So I think it should be a really exciting podcast. And thank you, Samuel, for getting us on here.
Definitely. Thank you guys. So the big question that everyone wants to know right away, how do you guys know each other?
So I'll take this. So Dr. Cohen and I, we actually have known each other for quite some time now, over 10 years. Isn't that right, Zach? We went to medical school together. At Chicago Med, and we've kind of just been in touch ever since. And then Dr. Krishnan and I actually know each other from Johns Hopkins. We trained together. He was an anesthesiology resident when I was doing my pain fellowship there as well. So we worked together while we were both in training.
And then Dr. Krishnan Chakravarthy, he was my attending during my pain fellowship at University of California, San Diego. And then somehow we all realized we knew each other. It's been sort of fun.
It kind of underscores how small the pain world can be, right? Like many people know each other through many different outlets, just because that's how the pain world can be.
Oh, completely.
It was awesome. I was on a conversation with Zach one day, and he was like, yeah, I'm talking to my friend Zafeer. I'm like, you know Zafeer? He's like, yeah, I know Zafeer. I was like, wow, what a small world. I trained with him at Hopkins. He's like, man, this is crazy. This is so, yeah, I agree with that sentiment. It is a really small world. And I think a very supportive culture of, I think as clinicians, we're, really looking at the field and the future. I think it really makes sense to reconnect with those folks that you've always been close to. So
definitely.
That's great. Yeah. I mean, it's always an excuse to talk to your buddies about something. And there's a lot of great people, I think, in pain medicine right now that really want to advance the field. And I think it makes it even better to have those friendships sort of backing those conversations as well. Excellent. It's a pretty cool spot to be in.
Excellent.
And it's crazy because, over 10 years ago when Zach and I were, little bitty medical students, we were learning from each other, in the anatomy lab and doing physiology and then we graduated medical school, and then Dr. Krishnan and I were started learning from each other in the pain world and anesthesiology, and then we all became pain physicians, and we continue to learn from each other in the pain world as well. So it's just that kind of underscores what happens in medicine. It's a profession of constant learning, and we just continue to learn from each other over the past decade plus.
That's excellent.
Yeah, I mean, I think Dr. Zafeer was a year ahead of me in medical school and definitely a mentor to me, and got me through a lot of long nights in the library and stuff like that. And then Dr. Krishnan was the same for me as when I was a fellow at UCSD. So it's cool to have both these guys as people to bounce ideas off of and talk to and use as a resource. They're definitely very smart guys.
Fantastic. I love that you guys still stay in contact and continue to educate each other on all the latest developments in your fields. So let me ask you this, starting off, we talked about change and just how things are happening. COVID is kind of the theme of 2020. It's changed how we do everything. In a general sense, how has what's been going on changed the way you guys practice?
I could start with this. It's been interesting. Prior to the COVID pandemic, there was another major issue going on as a public health issue, which was the opioid epidemic. And it's fascinating that, the conversation shifted timely and appropriately, but when you're really looking at our field and the impact of this pandemic on access to care, the dynamics for interventional pain physicians has really changed. And there is, I think, no point in our field have we seen the amount of industry innovation that we have seen in the last 3 to 5 years, where the definition of what is pain medicine and the change in our way we do care delivery, from not just pharmacology all the way to now people becoming extensive interventionalists. I mean, I think you talk to Zach and Zafeer, they'll tell you literally there is a new cadaver training course every weekend for a physician to learn a new technique. And I think with a pandemic where access to care, as well as a lot of information that we've seen from February to today, where we're still trying to struggle through what is factual versus what is, what is reality versus not. I think we are, very critical time in trying to understand how best to give our patients the best care in a climate where even today we have meetings talking about, do patients feel safe coming in? Mm-hmm. Do patients still want to access some of the things that we provide that's been bread and butter to our field? But at the end of the day, it is an elective procedure. So what are the risk benefits of bringing folks in? What's the role of testing in that process? I mean, I think we don't talk a lot about that and what that impact has on, is it sensible from a small practice all the way to a large health system that can take time of 2-3 months and do contact tracing? And to be honest with you, that may not apply for a lot of smaller practices. I mean, they need the funding to keep their practices open. I mean, I think, so we are, really trying to come up with a unified strategy across, I talked about at the society levels, where we did a lot of the COVID webinars and things of that to educate a lot of the clinicians. But I think it's a major issue, and I think we're still trying to figure that part out. And I think industry has been significantly impacted by that.
Yeah, I mean, I think for us, as physicians, the first thing we always want to do is keep our patients safe. And I think in pain medicine, when you have patients that are, on opioid medications, and as you're trying to wean them off, and then we have this deadly virus where you can't see your patient in person as much as you want to. It's been sort of a tricky position for everyone, because I like to see my patients every month, every 2 months, to make sure that they're safe, check in how they're doing. I really look at body language a lot with my patients, and just, their overall, physical appearance as a way to sort of make sure that they're safe. And I think, as we've moved to, some telemedicine and virtual medicine stuff, I think it's really just shown how important the patient-physician interaction in the office is, and to really, see your patients in person and to really keep a track on their well-being and keeping them safe. So I think it's been a tough spot for pain medicine, in the sense that, and I'm sure many other fields as well, that, now you're just really trying to keep people safe in one more regard, being the COVID-19 virus. So it's been tough, but my practice, we've done well and made the appropriate adjustments, and we've just kept it very safe for our staff and for our patients.
Right. And just to expand what Dr. Cohen said, medicine is a field where there is lots of innovation, but it's also in many respects steeped in tradition. And when the outbreak happened, it kind of just forced all of us to kind of reimagine what medicine is. And all of a sudden, we went from a world where we were seeing our patients in clinic, as Dr. Cohen said, every month or every 2 months. And we were forced to be placed in a position where we had to switch to telemedicine, whether we liked it or not. And, there are positive things about that, and there are negative things about that. As Dr. Cohen said, sometimes you can get a lot from a patient by talking to them in person, by seeing them in person, by seeing how they are. But in other respects too, lots of patients with transportation issues, who just cannot get out of their house or wherever they live to the clinic, are able to now communicate with the physician by other means. And that's all thanks to COVID. It kind of forced our hands and forced us into the 21st century in terms of, how we interact with our patients.
Definitely.
And I think it really showed too, as a community of physicians, how we can adapt so quickly to rapid changes to provide, still state-of-the-art and excellent care for patients, when something terrible happens. So, I think the physician community throughout the world, has really adapted and, done what they can to, continue treating patients the best that they can.
Sure. So Dr. Krishnan said one thing that I want to ask more about, and Dr. Baber, you brought it up too, and so did you, Dr. Cohen. Dr. Krishnan, when you said, still trying to figure out factual versus what's reality versus what's not, can you speak a little bit more to what you're talking about there?
Yeah, look, I sense a lot of time this sentiment of, it's just maybe a reflection of where we are, which is that, how do we really emphasize an impact of something like a pandemic when we are still trying to understand what is this virus doing? What is this virus causing? What's the long-term health impacts of that? And part of the challenge with that is, historically, when you look at past pandemics, one of the biggest things that came from that was the public health measures that dictated the impact of those measures in reducing spread, right? And you look at the classic example of the 1918-1919 pandemic, the biggest things that came out of that was social distancing, contact isolation, things that were put in place between even cities in the US that made a huge impact on how many cases were essentially established or found because of those measures. So where this challenge lies is that I think in this climate where there are lots of pressures in everyday things that we do, whether it's economic, whether it's care delivery, we have to get to some form of standardization in how you apply care in that setting. And that has to be based on good, sound public health measures and judgments that have been proven through historical use of evidence that they work. So what happens is that, you have a situation where I think where we are today is sometimes the idea of what is factual versus non-factual, which may be really well-founded in good science, gets debated. And then that's challenging because what people are not realizing, this is not suddenly going to go away today. We're not in a situation that this is something that's in a 3-month effort or 6-month effort. This is looking into what's arguably now factually, the number of cases are rising. You are eventually going to have a situation where the resources that you take for granted are going to be less and less available And then the choices that you make as a health system, as an individual practice, are going to have to be very strategic. And that's going to be important come in the early part of January, and probably extending to, we don't know how far this type of strain of COVID is going to be. But the point is that I think, to me, this has really brought a lot of, I think the pain docs have done amazing throughout the country in terms of adopting this. But I think factually, we are in the types of things that we discuss, there are certain things that I think are more black and white. And once we've, as a collective, you start to accept those certain kind of tentative facts, then you could make good decisions and guidelines that a lot of folks can follow. And that's really what is the basis behind a lot of the public health measures that have worked in the past. And that's what we should really be thinking about adopting. But that's just my opinion. I know certainly Zach and Zafeer, their thoughts on that. But that's just, to me, that's what's important. That's going to be more and more important going forward. Whether the stress of that impact is felt in the same way it has in the past, modern medicine has come a long way, but it's important to recognize that.
Yeah, I mean, just something to sort of add to Dr. Krishnan's statement. I think in medicine, not just with COVID, but this can probably tie into device and just probably every aspect of medicine. COVID-19 has been such a rapidly changing environment. I mean, sometimes from day to day, and I think we do the best we can with the data that we have available at that time. And I think it's very easy, and this can go back to, probably every aspect of medicine. Sometimes we don't do the right thing, looking back on, looking back on the results that we've gotten. But at the time that, the decisions are made, we're doing it, with people's best interest in hand. And, but data changes. Studies get drawn out an extra 1 or 2 years. We learn more about the virus. We learn more about treatments. We're going to learn stuff in December that we didn't know in February. So I think it's just as is medicine, it's an ever evolving, changing, dynamic.
Sure.
Right. And as they pointed out, there has been definitely an ever expanding element of COVID fatigue that has been going on. I don't know if COVID fatigue is just because, of expectations versus reality. I remember when we first started doing the social distancing, there was talk that, we have 2 weeks to flatten the curve. Right. And people were like, okay, great. Let's do this social distancing thing for 2 weeks. We'll flatten the curve and then life will move on as normal. And as Dr. Krishnan pointed out, that's not how the world is working. We may have to do something like this for, months or even years, and that can definitely play a role. One thing that I have recognized from my patients is how it is psychologically affecting them. Unfortunately, social distancing is also bringing about social isolation. And that's one thing that we need to show our patients, is that social distancing doesn't mean social isolation. There are things you can do to maintain proper social distancing protocols, but still prevent social isolation, especially in the pain world, where lots of our patients are elderly patients. They may live in a senior citizen facility where their family members cannot visit them, as it has been well documented in the news that, a lot of these senior living facilities are the ones where COVID-19 is disproportionately, affecting those small communities, because as we all know, our elderly patients are amongst the most vulnerable from getting bad outcomes from COVID-19. So, they're the ones that have to be cautious above everyone else. And that's unfortunately leading to social isolation. And so, we have to express to our patients, above all else, that they could Zoom with their family members, they can talk on the phones, they can they can, you know, do other things that can lift their spirits socially.
Sure.
That's a really good point.
Yeah.
Yeah, great point.
You guys have a lot to navigate. I mean, practice has changed because of telemedicine and how to make sense of that in your practice. The fact that you're trying to sort out what's real and what's not with all the, I mean, you're right. You know, in 2020, science is often debated now. Things that everyone said, that's obvious. We're now having discussions about what is that true? Or do people really want to believe that, even when it's blatant that that's what should be followed? So with making sense of everything, when you consider everything, how has it changed the way you interact with manufacturers? And then let's start with medical device. And then I also want to talk about pharmaceutical. But let's start with medical device manufacturers. How has this current environment changed the way you interact?
That's a great question.
Yeah, I mean, we actually had an instance in our office, you know, without saying any names or companies, because I really like this person as a person, but she actually we had a rep that brought COVID into our office. I think I was doing a procedure on like a Thursday or Wednesday. We found out she wasn't feeling well, or we didn't even find out until like next Friday. We didn't hear anything. And then she said she wasn't feeling well on Thursday, started not feeling well Wednesday night, tested positive for COVID, and then didn't tell us until Friday, you know, and so we actually told her never to come back to our office. And I think with good reason, you know, especially in this, you know, realm, it wasn't that we were upset that she had COVID or wasn't feeling well, you know, because she was feeling fine in our office, just that she delayed telling us for, you know, 8 days. So that was a pretty like big issue for us because, you know, we considered it that she, you know, put our staff at risk, put our patients at risk, you know, really put a lot of people at risk, and should have been much more upfront about that. So that was a huge issue.
Imagine.
Yeah.
You know, Dr. Baby here, you know, one thing that I could talk about is, you know, we work a lot, all three of us work a lot with spinal cord stimulator reps, and other reps as well. But I will, you know, for the sake of this question, just talk about the spinal cord stimulator reps specifically. You know, before COVID hit, you know, we were doing these trials, you know, so the way spinal cord stimulation works, and we talked about this earlier, Samuel, on a prior podcast, is that, you know, you do a trial, like that could be a week or so, and then you see how the trial goes, and then you bridge to implant after. What ended up happening with COVID is, you know, I did a few trials on a few patients. We were planning on doing the implant, and then boom, COVID hit, right? So, you know, the patient got excited. There was all these expectations that their pain was finally going to be addressed. And then, you know, this deadly pandemic of our lifetime hit, and they weren't able to get their surgery because, as Dr. Krishnan said, these are elective procedures. And when you have a deadly pandemic, those are the procedures that need to be delayed for obvious reasons. And so what happened was, I personally became much more reliant on our representative, on our spinal cord stimulator representative, because, you know, as we talked about earlier, Samuel, the representative is kind of the quarterback, you know, right? They kind of, you know, relay information between the patient and the physician. And so when this large delay between trial and implant occurred, you know, I was even more dependent on our representatives to kind of relay information between the patient and I, and, you know, maintain a relationship to kind of get us through, you know, the peak of the curve until elective procedures started to, you know, start over again. So, you know, in many respects, even though we weren't actively doing trials, even though we actively weren't doing implants, our relationship with our device representatives was as important as ever.
Sure. Yeah, it was critical.
Yeah, I have to that. Yeah, I mean, I think that's a great point. The reps are such an integral role with the patient with STEM.
Yeah. So I'll tell you, Samuel, that it's incredibly fascinating what's happened to industry. I've been fortunate to sit on the boards of a lot of the major STEM companies that are currently in the marketplace. And, there was times that conversations like this, they would look for advice such as, should we be testing every employee before they go into a physician's office? And let's paint an interesting picture for where pain space is today. In the past, probably about 5 to 7 years ago, the amount of interventional options that pain docs were doing in the OR was a lot less. And now you compound that by having so many different treatment options for our patients that all require an operating room part of care delivery. And then you're looking at a marketplace that's getting extremely crowded. Industry is scrambling in a way, because it's not just the fact that there is a pandemic that's raging. People are still trying to figure out, when do I use one product versus another? What's the right indication for one versus another? And to Zafeer's point, if you're in an elective situation, there is a tremendous amount of emphasis on industry also playing that role in the care management of the patient. And that comes with trying to get guidance on what's appropriate. So should I be testing every employee before they walk into a doctor's office? Should employees that have suggested symptoms even be going into a doctor's office in the first place? I mean, so these are things that I think, going back to my point earlier, if you thought that COVID was going away, clearly it's not. So people thought by summertime, hey, this thing would be resolved. We could go back to business as usual. I don't think that's the case. I think as a collective, people are going to have to start asking these questions. Should we be adopting certain requirements on the part of industry, and how does that interface with the health system? Because I can guarantee, in the same situation as Zafeer, it's 100% how large health systems think. If we took a big loss during COVID, I'm going to put the cases that are emergent, urgent over elective cases, because naturally you're going to want to prioritize the things that's going to end up making that health system solvent. So I think it's going to be challenging. I mean, I think come wintertime, there's going to be a lot of questions about guidance. And I think industry is going to really look to have physicians set some benchmark. Hey, you need to be tested before you walk into the office and interact with our staff, or you need to be tested before you interact with our patients. So I'm with Zach and Zafeer. I think there's a lot to be stated about the expectation on what physicians are going to really say with the dynamic of the companies that they work with, and kind of making sure patient safety is first.
Sure. Go ahead. Who's going to say something? Okay. So that's the medical device side of things. How has it impacted the way you interact with pharmaceutical manufacturers? Anybody can jump in.
It's been a little interesting. I sort of explained the situation we had before. That's probably, like a 3 standard, deviation outlier of situations. But, I think, we rely a lot on pharmaceutical reps and, device reps a lot for information. And, a lot of it is just sort of, when they stop by the office, say hello, tell us, new studies that are coming out, and, help us, help introduce us to new options for patients. Sometimes, you don't have that interaction as much anymore because of the social distancing, so, there is a lot of good information, I think, from reps that has been sort of, dropped just because of this. Whether, reps don't want to show up to the office, offices don't want reps coming in. So that whole interaction has, really been altered.
Yeah, I really like what Zach says, because I feel the same sentiment. We always talk so much about the interpersonal, whether it's interaction between patients and physicians or patients and our colleagues. And I mean, you get so much out of that part of it. I know we've become the digital world today. We turn on the video. Sam was like, "You're not going to turn on the video? What's going on? This is a podcast. Like, I want to see your face when I'm talking to you, but I mean, it's the same thing, you body language. And I'll be honest, I think it's a little bit easier to prescribe a drug, right? I mean, if you look at there's 6,000 plus pain clinicians nationwide, maybe more. How many are heavily interventional? And the point in that is there's not a right and wrong way. At the end, we want to do what's best in our patient, but it is a little bit easier to imagine that you're prescribing something versus getting into a setting where you need a lot of the ancillary staff. You need anesthesia, you need this, X, Y, and Z. So I think there's different challenges for both, but I'm with Zach. I mean, nowadays conferences are all virtual. I just don't even know how many people really attend these things, but there are podcasts that are awesome. People are using them to essentially learn a lot of things. So I think there's good and bad of that. I do miss the interpersonal interaction for sure. I think I would agree with Zach on that for sure.
Yeah, and I think, with STEM, one of the conversations we always have, Krishnan and I, is, which company is the best and this and that. And, I sort of believe it's the cowboy, not the rifle, and a lot, and every company actually works pretty good, but a lot of that is actually, my rep interaction with the patient and how much support they're able to give the patient, in how much troubleshooting they can help during a spinal cord stimulator trial or after during an implant. And a lot of that's sort of been changed, with COVID. I mean, does the patient come in and see the rep? How do we troubleshoot things over the phone? So, I think some of the relationships with the reps I work with has gotten even stronger, because we've both changed our practice together, and they've overcome issues as has, myself as a physician.
And I'll tell you, the one part that is really other challenging is training physicians.
Oh, yeah.
Think about
Right.
the days in the past, companies would have to set up these cadaver courses where you have 20 docs there that are all congregating and learning from each other. How do you do that? I mean, in this climate, are you going to do it through isolated? Is it the expense of that? So I think even that part has drastically changed. I mean, we interact and train together, we problem solve. So I think that's understated, that impact also.
Yeah. I mean, I'm going to a course this weekend, and I'm going to be really interested just to see how it is. This is the first thing I've done since, COVID, and I've been a little apprehensive about doing it, but, I want to employ this technology in my practice. So it'll be interesting to see, what changes are happening this weekend versus courses in the past.
Yeah, I mean, there are a few modalities that you can use to treat pain, right? So one modality is interventions, and a second modality is medications. And so, as Dr. Krishnan talked about earlier, when elective procedures were canceled during the height of COVID and patients needed to address their pain, and half of the way we treat our patients is through procedures, and you can no longer do procedures, you become even more reliant on the medications, right? And that could be scary because, as we know, there was an opioid epidemic out there. We don't talk about it as much, but it's just as strong as it was 1 year ago. And if you want to focus on non-opioid medications, you have to focus on, many other types of medications. And as Dr. Cohen talked about, sometimes you get information from pharmaceutical reps. And what I mean by that is they don't tell you themselves, what's great about their medication necessarily, but they also set up these platforms where doctors can communicate with each other. And that has turned virtual for the most part. I see Dr. Krishnan giving these talks all the time. And I learned from him because of these virtual platforms now that would not actually are easier. It's easier for me to hear Dr. Krishnan give a talk now than it was 1 year ago, because 1 year ago I would have to fly to California to hear what he has to say, but now I can go online and hear what he has to say through a Zoom meeting. And so in that part, knowledge has become even more easily accessible.
Right. No, that's a good point. I mean, I think in this environment, just how much easier it is to get a hold of people that are very busy and in different levels of leadership, and just get access to them because of what we're all forced to do. It's really been a lot easier thanks to COVID. One thing that you guys talked about a little earlier was how, you guys are pain interventionists. You guys focus on pain. That is the field, and it's shifted now to COVID. But Dr. Baby, you just said the issues around pain are still very much there. It's not like that's died down while COVID has increased. So has it just become relatively hectic to manage, and everyone is just trying to spur of the moment figure things out along with manufacturers? Or has there been some kind of process you guys have been able to implement that's allowed you to still address what's going on with pain in light of what's going on with COVID? I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top performing medical sales professional, and also how to masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.